Hi, I'm Gail Wetzler, and I'm a physical therapist in Orange County, California. And I'm also privileged to say that I'm the director for the Barral Institute. And part of our system in working with the growth of visceral manipulation and the growth that Jean-Pierre Barral has gone into his studies in working with people has been the development of neural manipulation. And the nervous system in and of itself is such a wonderful organism of information highway. And some of us are more familiar with neurotension signs and the differences that other studies that we have done with neurotension signs. And that's a great course to get you oriented to the anatomy of the nervous system and what it does and through the peripheral systems in our body. Where we have taken it, neural manipulation has gone into the organs, it's gone into the brain, it's gone into the cranial nerves, and so we envelope from the brain through the upper extremities into the potential of the thorax and into the lower extremities, where that orientation of a nervous system dysfunction not only affects the sheath to which that nerve is in that you've learned in other courses, but how that is distributed into an access point of restriction for other nerves as it connects in the information highway, potentially all the way up into, say, a cervical nerve, if it's from a knee, or into a cranial nerve as it goes through the vagus system and may go into the lower thorax and the lower abdomen and affect the connections that might have from other areas in the body. So we go from specificity in the neural manipulation to how does something local as an impingement, say in the shoulder, affect the whole body. So if we have a frozen shoulder and you're thinking neurological impingement, say brachioplexi, level 5, that it's going down and causing numbness in the hand, we listen to the nervous system. And it may be very well in that brachioplexi, but what might have promoted that in the first place as the branches get closer to their roots? Or was it another area down the spinal cord that really started that? And the dural meningeal component of that is what created the change to give you the signs and symptoms on the outside. So the learning that comes from understanding the entire nervous system and how it affects the whole body is what you will get in going through the neural manipulation courses. It's phenomenal to be able to put your hands on a place and feel a change that occurs in other areas of the body that they could have come in and complained about, but you had no idea in the connection of a shoulder impingement creating the cervical or a cranial nerve or eye pain that can come from that whole meningeal component. You'll enjoy it. Come and see and get a sense of those classes.